I'm delighted now to introduce our keynote presentation on sustaining accessible, independent living in the community. We have two speakers who will be exploring the Nova Scotia Human Rights Remedy. Maria Medioli is a registered social worker, chartered professional accountant with 25 years of strategic problem-solving experience in the public, not-for-profit and private sectors. She's currently the Executive Director of the Nova Scotia Disability Support Program. And Thivjan Tharmaratnam is dedicated to creating spaces where diverse voices are heard and valued, both in workplaces and in the broader community. His career has included roles across Canada, and he is currently the Executive Director of Inclusion Nova Scotia and Chair of the Disability Rights Coalition of Nova Scotia. And bring Maria and Thivjan to the screen. So over to you, Maria.
Okie doke. Can everybody hear me?
Coming through loud and clear.
Okay, great. Well, thank you for having me. And I apologize in advance. Some of you, like Thivjan, have probably heard my presentation 1,000 times and are bored to tears, but hopefully you'll hear something new. I'm excited to be here to talk to you about the remedy. I guess we're the talk of the town in both a good way, because we have this remedy which is court ordered, but also in a bad way that it actually took a court order to implement the changes that I'm going to tell you a bit about. I will just go on to the next slide and share my screen. I also want to acknowledge that I'm presenting to you here from Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. All right, can everybody see that? Why is there a remedy? What's actually in the remedy, and how's the implementation going? So we'll start, I'm just going to give you some background on where we were in Nova Scotia before the remedy. There was a lot of fragmentation across the province in our supports for persons with disabilities. And that was because back in 95, 96, we did what was called service exchange, where the municipalities who were delivering social services at the time transferred them to the province. But they essentially transferred 52 separate programs to the province, and the work wasn't done to make them consistent. So there were a lot of differences across the province, and even once the province took over, those programs were regionally administered. So there were significant differences in the experience people would have with service depending on the region where they were. And there were a lot of access challenges to supports. There was an inconsistent interpretation of eligibility, but there were also aspects of eligibility that were discriminatory and that were identified in the human rights complaint. Particularly around policy 9.3 and 9.4 that essentially said if an individual's medical or behavioral support needs exceeded what the disability support program provided, you were ineligible. So essentially saying that if you were too disabled, you'd be ineligible for the disability support program. Programs were and continue to be income tested, which were barriers. And there was really what Eddie calls the scarcity mentality. It was like DSP was the oasis in the desert, the only program available. And so everybody was trying to get into DSP as if that was the panacea. We had capped programs, which meant there were limits. And so you essentially had to wait for somebody to leave a program in order to be able to go into it. And that created serious blockages, even in terms of more appropriate cost-effective options. So we had individuals and institutions who couldn't move to less expensive community-based options that were more appropriate because of these program caps and long wait lists. Also, there was a lot of what I call program rigidity. And so our programs were almost like boxes. If you lived at home, you had to be in a certain program called Flex if you wanted to live independently. And you lived in ILS. But there were policy blocks in each of those. And so often those programs didn't fit the individual needs. And there were many failed attempts at transformation. There was one in 98, the Kendrick Report in 2001, the Transformation Roadmap. So it wasn't like people weren't aware of the challenges. There was just many failed attempts, littered attempts along the way. So in the end, there was a finding of systemic discrimination against the province of Nova Scotia for a lack of supports for persons with disabilities to live in community. The finding was against the province of Nova Scotia as a whole, not just the disability support program, which I think is a really important element. And the two parties, the Disability Rights Coalition and the Disability Support Program, worked together to create the remedy. We engaged independent reviewers, Eddie Bartnick and Dr. Tim Staton, and they wrote a report, which is available online if you want to see it. And it was basically a 5-year roadmap to remedy the discrimination. The remedy was agreed to by all parties and was ordered by the Human Rights Board of Inquiry on June 28th, 2023. And there's a lot of requirements. We have to report twice a year on progress and the targets, et cetera. And in fact, our second annual progress report is due tomorrow. And so I think that makes a big difference in terms of accountability and transparency. So I want to touch on the 4 grounds of discrimination because they help understand what's in the remedy. These were the issues we're trying to address and were identified by the Human Rights Commission. The first one, which everybody associates with the remedy, is unnecessary institutionalization. So Nova Scotia continues to have purpose-built institutions for persons with disabilities, ranging from what I call the big 7, because there's 7 of them, where the largest is 140, where persons with disabilities are congregated and segregated. We still have group homes, and we also, those are the purpose-built ones. And so under the remedy, we'll have to decrease the occupancy to 4. But we also have other types of institutions where persons with disabilities are living. Nursing homes in particular are an issue. There's 455 people under 65 living in nursing homes, and often individuals are trapped in hospital, forensic units, et cetera. And in fact, the 3 individuals who originally launched the human rights complaint, Joey Delaney, Sheila Livingston, and Beth McLean, had each been in the Nova Scotia hospital, a mental psychiatric hospital, for more than a decade. And that was really, they lodged the original complaint. So those are examples of the types of institutionalization we need to address. The second grounds of discrimination was the right to assistance denied. And so that goes back to that policy I talked about, 9.3 and 9.4, because those individuals really should be eligible. They meet the eligibility criteria for the disability support. We just added a clause that said you're ineligible because we can't support you. So that's an example of assistance being denied to those who are eligible. The other group are individuals who are on our wait list, who are eligible for disability supports but aren't being supported. So we have a large wait list. About 1,100 individuals are on the wait list who are actually in the disability support program but waiting for a different option, but they are being supported. This other group that originally at the time of the complaint, there was about 500 individuals who were receiving nothing. The fourth area of discrimination is denial of community of choice, and that's a really, to me, a central one. Many individuals in Nova Scotia have been forced to leave their community, their home, their family, their support networks to access supports, and they've often had to leave their community because those supports weren't available in their community. So that's a very common story across the province. And then the last grounds of discrimination was delays in assistance. I talked about our wait list with about 17 or 1,800 individuals at the time of the complaint. And it's not just the numbers, it's the length of the wait. I think the average was about 5.8 years for individuals waiting on the wait list to access service, but there are examples of individuals waiting much longer than that. And so that was considered an unacceptable delay in providing requested service. So that's where the remedy came from, but what's actually in the remedy? I like this slide because it really highlights what these 6 key directions I'm going to talk to you about are trying to enable. This is all, really the remedy is about, first of all, more choice for participants, more choice for people with disabilities. They have very limited choices, whether they're living in an institutional setting, but often even living in community in terms of how they spend their day, who they live with, et cetera. So all of the initiatives and changes and program design are really geared towards more choice. They're also intended to be person-directed, to go back to the person with the disability and putting them in charge and giving them the autonomy and the tools to direct their life and make choices about their life. but also investments in community, because a lot of this started from a lack of supports in community. So you'll see there's a, I won't be going too deep, but there are a lot of pieces around increasing capacity of communities to then support people with disabilities to live in their communities. So there's 6 key directions in the remedy, and they really all interact and with each other and leverage each other. So we can't really have one without the other. We have to do all 6. And they're really meant to enable each other. So the first key direction is around support planning and coordination. And we're introducing a new system of individualized planning and support coordination to drive more person-directed planning with a focus on community-based services. So, I mean, there's a lot in that statement, but I'll tell you where we're coming from. We're coming from a system where we had what are called care coordinators who did everything from eligibility assessment and funding to support planning to placement to crisis management. And that was not effective for 2 reasons. First of all, they had incredibly high caseloads. I think the average was 83 at the time of the remedy, but some having caseloads as high as 110 and 120. So that's not, conducive to relationship-based supports. That's not conducive to having authentic conversations with individuals about their goals and dreams. That's really just putting out fires. The other issue was that the funding piece was also part of the mandate. So you had somebody doing the funding and the planning. And there's really almost like a conflict of interest there, and the two get conflated. So there's an intentional separation now of those functions. So we have 3 new roles replacing the care coordinator. We have the local area coordinator that I'm sure some of you are familiar with. And, that's a framework of practice rooted in community, supporting persons with disabilities to live in their community and access the natural supports to have a good life like everybody else. And so they will be supporting both people who are eligible for DSP, but also anybody who self-identifies as having a disability. And I think that's a really critical piece. Because as I said before, DSP was a bit of an oasis in the desert and everybody was trying to get in. And really accessing funding and supports or, services isn't necessarily a good life. And so we want to support people to access those natural supports. And the LACs will have a small bit of what we call Sparks funding so that they can generate those unique solutions that might make a big difference in somebody's life. Then we have the intense planning and support coordinators, and their caseload will be capped at 20. And they will be supporting those with the most complex needs and those leaving institutions. And again, that's so critical to give them the time and space to really work at the individual level, to imagine what their life could be like in community and to help create that path towards it. And then the final role are what we call eligibility, funding, and assessment coordinators. And that's exactly what their mandate is, to determine eligibility for DSP, determine funding, and conduct assessments. So that's a real quick and dirty on direction number 1. There's one other piece in direction number 1 that I do want to mention, is that we're also developing a peer support planning program. So this would be where individuals with lived experience are supporting other individuals. So that's just in design now. So we want to be able to provide a variety of paths for individuals, back to that choice piece, to access support planning. The second key direction is closing all institutions. That's the one that I think everybody associates with the remedy. But just to be clear, we have to actually close all the big institutions, the ARs, the adult residential centers, regional residential centers, residential care facilities. They need to close, and we need to decrease the occupancy in all other homes to 4. And we also need to include it in the closing institutions, even though we're not closing nursing homes, is providing options to young people living in nursing homes to move into community. We've also implemented a moratorium effective January 1st on all new admissions to the large facilities, the ARCs, RRCs, and RCFs. And then January 2026, there'll be a moratorium on admissions to group homes. The other piece that's unique to us about the remedy is we've actually established regional closure teams. So these are dedicated resources to closing the facilities. In the past, we've closed a couple of facilities, but it was always off the side of somebody's desk. So these are individuals whose full-time job it is to work with the facilities and teams to facilitate closure. And there's another role, a community living facilitator. We have one in each region of the province, and they're actually working in community, identifying and developing local resources to support people as they move back. The third key direction is around community-based supports, and these are new community-based programs to facilitate a home and a life in community. So, you know, if people are moving back, we need to fill the gaps that existed prior to the leaving. And there's a couple of programs that we're introducing there. One is a home share option, which I think some of you, I'm sure, are familiar with. We actually had a home share program, but it was a little antiquated and maybe paternalistic. The new home share is meant to be much more, I would say, two partners, equal partners, working together to create, you know, to share a home, and really anything, just about anything goes to make that work. And also a school leavers program. And this is a transition planning program where we're going to get into schools, working with young people with disabilities early so they can start to chart out their path for a good life and community. So when it's time to move out of school, they have options besides an adult service center or a sheltered workshop. Multidisciplinary supports are key direction number 4. And so we are going to be establishing multidisciplinary or allied health outreach teams across the province, one in each region. And again, this is because often individuals ended up in institutional settings to access these types of supports. And so we have to make them available in community. And the outreach teams will really have a focus on the unique needs of the people that we support, in terms of not just looking at allied health supports as a one-time intervention, but really about how do those supports facilitate a good life in community. Key direction number 5, which I often say is my favorite key direction, even though it's like saying you have a favorite child, but it is my favorite key direction, just because I think individualized funding can really be the tool to enable choice and autonomy. And so when we say individualized funding, we mean the level of funding an individual receives is unique to their disability-related support needs. It's attached to the individual, so it's portable, regardless of where they go or how they're supported, and it's self-managed and self-directed. And so right now, about half of our participants are in a form of individualized funding, but not as robust as I've described it. And so over the 5 years, everybody will be shifting to individualized funding, and we'll be introducing what we call an individualized funding administrative backbone. We have a request for proposals for that out right now. And that's a support service to help families and participants administer and manage their money. So we don't expect that all families or participants will want to self-manage all of their funding, but they certainly can self-direct it and determine how it will be used, and they can use this administrative backbone to assist them as they see required. There's also a component in the IF bucket of having IF coaches to support people in developing the skills to self-manage their money, and also peer coaching, again, one-on-one with people with similar lived experience, coaching individuals to self-manage and self-direct. And then the final key direction is really about system capacity. And I often say my tagline is, this is a cultural revolution, not a technical solution. I mean, the technical stuff, tricky, but you know, people have done it elsewhere. When I think of IF, for example, there's lots of examples of IF policies and IF programs. But changing that cultural piece, both in communities, families, my own staff, participants, you know, it's a challenge for people to think differently. It's a challenge for people to conceptualize and peel away all those layers of ableism that got us here in the first place. So there's a whole host of initiatives and requirements under the system change, including an intergovernmental roundtable that has been established and is being chaired by our senior deputy across, you know, the departments of education and health and municipal affairs and housing, et cetera. It includes, you know, an external evaluation as we go. It includes conferences. We've had our second Rebuilding Hope conference on March 29th, which is where everybody comes together and, you know, learns more about the remedy, talks about their experiences so far, and we share information. And if anybody's interested, the whole thing is videoed and available on YouTube. Just Google Rebuilding Hope. And training, you know, there's a whole host of initiatives rolled up, workforce strategy, et cetera, under the system change. I'm going to talk about the regional hubs for a moment, because I think this is really some of the magic sauce for the remedy. Because back to talking about why people had to leave their, home communities, was to access the types of services that we're going to have available in a regional hub. So we're going to have 4 regional hubs across the province. And it's not an office, it's a collection of services and supports that are, clustered in a region, but delivered locally in community. So as I mentioned, there'll be multidisciplinary and clinical supports through our outreach teams, community capacity building through the regional advisory councils, and our community living facilitators. So we have established on that topic 4 regional advisory councils, made up of at least 50% First Voice, whose mandate it is really to identify what the local issues are, to provide solutions and propose options for addressing them. And they'll also have a pot of innovations funding to pilot new and unique solutions. And also part of their mandate is to communicate to their communities about the remedy, what it is, breaking down barriers, bringing people along. So that's the community capacity building piece. The individualized funding will be available regionally through the eligibility funding and assessment coordinators, those regional closure teams I talked about, working on the ground closing facilities, and then individualized planning and support. I like this slide. It's back to my favorite key direction, individualized funding, but to give you an idea of where we're headed and what the vision is for the future. In the past, it was a fixed menu of programs, as I mentioned, and they were boxes. And if you didn't fit, then you were in trouble. And so under IF, people will receive their individualized funding and make a plan, and they can choose who they live with. So they can choose to live on their own, with friends and families, with roommates who are also DSP participants, with a community member who's paid to provide support, as in our home share. And there may be options here we haven't even thought of. The purpose of this slide is just to open people's mind to all the possibilities. And so they could choose to live in a home they own, in a home they rent, in a room in somebody else's home, in a home owned by a service provider. And they could choose, as we talked about, all those options to completely self-manage their funding with support. They could self-manage it through the IF backbone, or they could have a service provider manage their IF. And the supports could be supports that come in the home, paid or unpaid. They could be supports in community. They could be supports that live with them. All of these options and more are how we envision the future of IF. So how is the implementation going? Well, today is probably not the best day to ask me, just because I'm still working on that annual report to the court that's due tomorrow. And, in some days it seems like the worst of times, and then other days it's inspiring and exciting. But I think I would say that this is based on feedback from Eddie, who I know is on this call, that according to them, usually these types of system transformations by this point, after 2 years going into year 3, in many other jurisdictions have fizzled. And I would say that we're just gaining momentum. It's certainly not perfect, and there's lots of challenges, but I think we're gaining momentum, and I don't think there's any going back. And I think this is for a bunch of reasons. I think it's due to the sustained advocacy of the Disability Rights Coalition, who, many times are the bane of my existence, but it's because of their advocacy that we're here today and we have a remedy. And Thivjan, by the way, is the chair of the board. And so, it's because of their hard work, all those years, 7 years in court, that they fought, and they continue to hold us to account. Government leadership has come. It's been there for us. And in fact, the premier made an apology at our first conference for the discrimination, and there continues to be a significant financial resource commitment. We received 120 additional frontline positions, for example, which is probably a record for provincial government. The collective inclusive leadership, like I said, Thivjan and I are sometimes, as an example, on opposite sides, but we both have the same desired outcome, and we do work together, I'd say quite well, to move forward that agenda. There's defined and ambitious timelines. I mean, it does make a difference when I know that in 6 months I have to go to the court and report against very specific accountabilities, including things like caseload ratios that are established. We have this cross-government approach, and we are working with other government departments, education, health, etc., on different components of the remedy. And like I said, the annual reporting, the targets and the indicators really make a difference. And the whole of population approach, which I love, is that we're not just focused on people in DSP. The idea is to support all persons with disabilities to live a good life in community. And that's what I really like about the remedies. There's pieces to make that happen. So I'm on my last slide because that little clock is there. I think I'm okay for time, but it makes me a bit of a speed talker, so I apologize. But I did want to say that in closing, I do feel like we're rebuilding hope. And rebuilding hope came from First Voice. What were we going to call the conference? And first we said hope, which was homes and opportunities, possibilities, and empowerment. And then we agreed that we're not quite there yet. We're rebuilding the hope. We haven't quite landed on full hope, which I really liked. And here's some photos from our two Rebuilding Hope conferences. The one in the top left is me with two members of the Mi'kmaq community at our conference that in March, and Mary Agnes to the far right is actually on one of our advisory committees. Below is Tim McDonald holding his artwork. That's the Transformation Butterfly. And he developed the icon for the conference. In the middle is actually our minister. I'll be really quick, meeting with the Disability Rights Coalition. This was just a couple of months ago. And so it was great to have our minister meet with the coalition to start to develop a strong relationship as he's a new minister. And then finally, the shared values, again, which were developed by our First Voice Advisory Committee. And this is a slide of them presenting those values. These are our remedy values. And they were presenting them at the conference. That's it. So thank you.
Yeah, do I just go there, Hazel?
Yeah, please, over to you.
Thanks, Maria. Yeah, so I was just asked to come on to kind of share some perspective about the Disabilities Rights Coalition and how we're moving it forward. I realized I got to stop wearing this shirt because every time we present, Maria puts up that photo and it's the same shirt that I wear. So I'm gonna get a new shirt. So yeah, once again, my name is Thivjan Tharmaratnam. I'm the Executive Director of Inclusion Nova Scotia, which is a provincial not-for-profit organization that advocates for the authentic inclusion of people with disabilities and their families. And I'm the current chair of the Disabilities Rights Coalition. The Disabilities Rights Coalition at its core is a cross-sectoral group of people with lived experiences, families, advocates, community organizations working towards to advance the rights of people with disabilities. The coalition actually formed years ago. It grew out of the Kendrick Coalition. As Maria mentioned, there has been many reports and many things done previous to the remedy in Nova Scotia to address some of the gaps in the systems and some of the concerns. And one of the first ones was the Kendrick report. And through the Kendrick report, there was a variety of people who came together to provide consultation. And when it didn't move forward, the Kendrick Coalition was formed to try and really push for that. So I got to stress, like, we wouldn't be here today without the work of the Kendrick Coalition, which morphed into the Disabilities Rights Coalition over the years to continuously push for the human rights case and then the remedy. And once again, the Kendrick Coalition and the Disabilities Rights Coalition was it was a group of Nova Scotians who believe that people with disabilities needed to live inclusively in community and have their rights heard and recognized. So where it was previously when it was the human rights case and we were, I guess, more adversarial and combative, because at that point the Disabilities Rights Coalition needed to be. It was really around ensuring that the human rights case was pushed through, and we were the legal driving force to make sure that the case went through the courts and got recognized. And so together with the individual complaints. We challenge the systemic discrimination faced by people to have who are forced to live in an institutionalized setting, and really move towards a system where they would be able to live authentic lives in community with the supports that they needed. The case was described at the time as a civil rights case of our generation, and it speaks really to the depth and the structural changes that collective actions can achieve. Now, as we sit here in this moment of the remedy, although we sit in a space where we want to ensure that we are holding Maria and the province accountable, and I want to stress that I think the Disabilities Rights Coalition, and in particular through the work and the conversations that we've been having or had with Eddie and Tim and the Global Leadership Exchange, recognize the need to really push this at the provincial level. So even though we did get the provincial acknowledgement from the Premier, we know a lot of this work is still landing within the disability support system and within the Department of Opportunities and Social Development. And so really now it's about how do we ensure that all the ministries, housing, education, are all coming to the, et cetera, to coming to the table to make sure that the various directives are implemented. So as we hold them accountable, we are also working in a collaborative manner to ensure that this thing moves forward, because we know that going back to the courts and going back to the legal process is just going to delay things. And we also recognize that, like Maria mentioned, this is a huge cultural shift and a huge change within the sector for individuals, for families, and any momentum that is lost through the legal process is just going to deter that and create almost a polarization of, does this need to happen? Should this happen? Because we're already hearing those voices, and we're hearing the fear that comes from the remedy and the transformative changes in stories that are popping up. And it's really around how do we, as Maria said, rebuild hope and hold on to hope and keep pushing forward as a coalition and bringing the positive stories to head and the positive wins, and really pushing to hold the timelines and the directives accountable in a manner that is collaborative and meaningful so that the remedy does get implemented. So the DRC, I mean, we're more than an observer, I guess, in this situation. Really, we're the connection to the people. We are the coalition of individuals, families, service providers who can bring the concerns forward, highlight the gaps, ensure that these directives and changes are made at a systems level, but then also at a level across a province that is equitable. And I think that's one of the key roles that we play. And then I do think that we, as we have moved forward and as we have seen the progress and the successes, it is around, pushing that hope and pushing that pushing people to see the possibilities that can come with the remedy. So inclusive leadership in this context means really making the space for all voices. It's not just making sure that people are heard, but it's about ensuring that we're on the agenda. It means moving at a speed of trust and refusing to leave people behind. The remedy provides us really good opportunity to showcase how advocacy isn't separate from leadership. Advocacy is leadership, and the coalition of people guides the remedy's transformative work. And the remedy builds the resources as a province that supports people to work with people, not on them. And I think that's really the shift that we're seeing within both the disability sector, but then also hopefully we'll make strides in seeing that on the provincial scape as well. So real change happens when community systems and government shift in response to those decisions. And we've seen, as I've been fortunate enough in this role, but then also in my role as executive director of Inclusion Nova Scotia, to be able to talk about the remedy both locally to various groups, but then also provincially in Ontario and BC. And people always ask, how do we get the remedy here? And beyond getting a human rights complaint and a human rights process going, which, like I said, took over 20 years to really go from the Kendra Coalition all the way to where we are right now. I think it is that collective advocacy and the building of that collective voice and across the province that allowed us to do that. I mean, Nova Scotia, we're fortunate that we are small in numbers, but I think that ability to bring this to the forefront was huge in doing that. And I gotta give credit to the people like Barb Horner and Marty Wexler who were there from day one and fought through it and were sticking with it all the way to where we are today. And so as the coalition has moved towards this monitoring of the remedy, really we're watching we're pushing Maria and the team, as well as partnering, to ensure that the full realization of the human rights decision. And as we continue to grow the movement, for the coalition, it's really around how do we connect with people at the local level? How do we get the insights, the stories from folks, so that we are able to highlight both the concerns as well as the wins within community around the remedy. Although there's a lot of fear that comes with this transformative change, it's an exciting time for Nova Scotia. And I know that all eyes are on Nova Scotia, and specifically all eyes are on the sector. And as we move away from problem solving and getting people to instead, imagine hope and lead with possibilities, we hope that this can be seen as an example for the possibilities to come across the globe. Look at that, under a minute.